Hello all the viewers. In this video, we are going to discuss about what is hernia, what are the types of hernia, what happens if hernia is not treated at the right time, what are all the treatment options available for hernia, can hernia be treated through medicines or through any procedure, or does it require a mandatory surgery, and what are all the available options in surgery, what is the difference between an open hernia surgery and a laparoscopic hernia surgery. So let's dive into the topic. So next comes to the point, okay, we are all okay, and even though if people are diagnosed with hernia, what to be done or what happens if hernia is not treated at the right time. So let's start with what we are seeing in this picture. So what we can able to appreciate in this picture is the initial layer is nothing but the skin, and underneath the skin the yellow layer which we are seeing is the fat, which is common in everyone, and this brown color thing which we are seeing here is nothing but the muscle which is protecting the intestines. These are all the tubular structures are nothing but the intestines. So as we rightly discussed, what is hernia? If there is gap in the muscle, we can appreciate here that there is a gap in the muscle. We can see there is no red thing in between. If there is gap in the muscle, the intestine which is inside tries to come out through this gap, which is referred to as hernia. So this is the first stages of hernia, where we won't be able to appreciate anything. The skin is going to be flat from outside, but whenever there is increase of intra-abdominal pressure, the intestine tries to come out. This is the initial stages of hernia. In the next stage of hernia, the patient can appreciate a bulge over the skin, and the gap between the muscle has increased, and in this stage, if pressure is applied from above, if you press the skin from above, the intestine goes in and this skin becomes flat like this. These two are referred to as reducible hernias. Means we are able to push back the intestine into the abdomen. These are referred to as reducible hernias. If the same hernia, if the duration of hernia increases, the intestine still goes out and there will be a very large bulge over the skin, and in this stage, even if pressure is applied from above, the intestine may not go inside because there will be Fevicol bondings developed between this intestine and the skin. Thereby, the intestine prefers to stay out rather than going inside. This stage is referred to as irreducible hernia. Means we are not able to reduce it back or push it back. Even if patients comes to us in these three stages, we are able to offer them a laparoscopic surgery or a daycare surgery, where we are able to complete the surgery without any major cuts, and maximum to maximum, depending upon the patient condition, he can be discharged in a day, or if they have any comorbidities like uncontrolled diabetes or heart problems or neurological problems, 1-2 day extra stay may be needed depending upon the need. These three stages are very easy to manage, but the most bothering stage is this stage, which is referred to as strangulated hernia. What exactly happens in this strangulated hernia is, this is a die-hard emergency. Why? Because the intestine in all these stages, in all these three stages, the intestines were coming out, and in these two stages they were not going inside. In this, they were going inside in these two stages. Those were not going in this stage, but still in these stages there was no compression over the intestine as such. Whereas when it comes to this stage, there is, because of tight ring over this region, it blocks the blood supply to the intestine. If you can notice in this picture, so this is the normal color of the intestine, and because of any twist or tightness happening at that region, the blood supply to this part of the intestine is gone, which we commonly refer to as strangulation. This is a die-hard emergency, because what happens if this is left as such? The intestine lost its blood supply, so the intestine starts dying, and that too, it being an intestine, This is the part where all the food which is being taken by us is absorbed by the intestines and delivered to all parts of the body. So for the intestine to do all this job, it will be having immense amount of blood supply. If the same immense amount of blood supply is cut at once, it starts dying at the same speed, and once it dies, what happens? This is a tube-like structure, so it gets punctured at one side and all the contents in the intestine tries to get into the abdomen or outside. So this is nothing but like a poisoning, because what we generally pass is stools every day, because those are contains harmful bacteria or undigested food. If the same undigested food and the bacteria gets mixed into the body or blood of our circulation, then it causes a die-hard emergency, which may sometimes be fatal also. So to prevent all these complications from happening, what we generally advise for any hernia patient, whether they are symptomatic or not, is a surgery, because there is no medical treatment for hernia at all. Hernia can only and only treated with a surgery. What we generally do in surgery, in any hernia surgery, is first step is the intestine which is trying to come out has to be positioned back into the abdomen. And why the hernia has happened? Because there is a gap in the muscle. So the gap in the muscle will be stitched together, and to prevent hernia from happening again, we'll be placing something called as a mesh inside. How exactly those works, we will be seeing. Suppose this is a case of an inguinal hernia, where the purple color here, all these indicates the potential sites of weakness where the intestine can traverse through. So what we'll be doing in these surgeries is, we'll be covering all these potential sites of weakness in the muscle with something called as a mesh. What is this mesh? Why we need to place a mesh in any hernia surgery? Because what this mesh does is, it offers additional protection to the muscle which is already weakened. How this mesh works, or what happens if mesh is not placed? For example, take myself, like right now I am weighing 80 kgs and I have went to a tailor and I have got a shirt stitched for myself, and once the shirt is delivered, it was bit comfortable and I was able to do all my activities with ease. If the same myself have grown from 80 kgs to 120 kgs, if I try to wear the same shirt now, if I am doing these movements, there is a chance that the buttons may get tear away. Why? Because to my 80 kgs, the shirt was fitting enough. If I grew to 120 kgs, the same shirt may not fit me well. Why? Because there was gross difference in the weight of my body. In the same way, if we just stitch them, close the gap in the muscle, and if we leave it as such, if there is increase of intra-abdominal pressure, or if there is any pressure that occurs on the abdomen over the closed gap in the muscle, the gap may again open away, thereby leading to failure of the surgery. So to prevent that from happening, always in any hernia surgery, especially that happens over the abdomen, it has to be strengthened with a prosthetic material called as mesh, thereby the chances of hernia happening again doesn't happen.